Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Rheumatoid arthritis is a condition that's an inflammatory type of arthritis. It's different from what people commonly think of as osteoarthritis because it's inflammatory and it can actually cause erosions or I tell patients where it actually eats away at the bones. It can cause a lot of deformities. The way it's different is it's characterized by hours of morning sickness where people get out of bed and they can barely get up. Sometimes they'll get up at like 3 in the morning just to get ready for their day and take a hot bath because they're so completely stiff. The stiffness and the pain seems to get better with activity.
Why do people develop rheumatoid arthritis?
With rheumatoid arthritis, the joints actually become red, hot, swollen, like there's actually fluid in the knee or in the hands.
Who's at risk for this type of arthritis?
A lot of patients say, well, why did I get this? And I say, we have a 2-hit hypothesis. The first hit is genetics, which you can't control or do anything about. The second hit, we think, is some sort of environmental factor where you already had the genetic predisposition and then something happens, like a huge stressor, a divorce, a death of a loved one, a fall, a motor vehicle accident, and then it just pushes you over to develop the manifestations of the disease.
What are some treatments available?
Maybe 20 years ago, all we had were large amounts of aspirin to the point where you would take it and you would get a stomach ulcer or your ears would start ringing because that's one of the side effects with large amounts. And nowadays we have a lot of treatments such as methotrexate, which is considered a mild chemotherapeutic agent. There's also, I'm sure a lot of patients and you have seen commercials on these other drugs called biologic agents, and they're usually injections.
Is this condition reversible?
It can be reversible, which is what's so exciting about the treatments for rheumatoid arthritis. Once you treat it and people are in, I guess you could say, remission, you wouldn't even know that they had rheumatoid arthritis if they do really well on certain drugs.